With over 1.8 million new HIV infections recorded by the United Nations globally, statistics show that Nigeria accounts for half of all new infections in West Africa. Now, experts are particularly bothered that at a time when rate of mother-to-child transmission of HIV is reducing, even in countries poorer than our nation, we're still recording new cases, especially that of babies born with HIV/AIDS. Why is that so? Despite the combined government efforts, civil society, private, foreign partners' effort and concern towards stopping new infections, more cases are being recorded. I'm still asking, why is it so? Now, the global effort to end HIV/AIDS as a public health threat by 2030, is that unfeasible? What is the way forward? Questions, all these and more are issues we bring on the table on Nigeria Today. Thank you for joining us. My name is Blessing Abu. Well, in the studio, I have guests already seated to take a look at issues of new HIV cases in Nigeria and the way forward. I'd like to welcome first Dr. Uche Okoro. He's the project manager, Federal Capital Territory Agency for Control of AIDS, that's FACA. Welcome to Nigeria Today.
Thank you for having me.
And also we have in the studio Mrs. Gloria Blessing Ogodo. She's the Financial Secretary of the Association of Positive Youth Living with HIV/AIDS. That's APIN for short. Thank you for coming on the program. My namesake, how are you?
Fine, thank you.
Oh, great. Now, really, this is something very heart-rendering. Despite all the effort, like we said, there had been concerted effort over the years, and we felt by now this shouldn't be what we should be saying. We should be having reduction. But what is not adding up, Dr. Okoro?
Yeah, thank you for having me in this program. I want to say that we have success stories as regards HIV response sector in the country and also in FCT in particular. The investment over the years is paying off, despite all the data we are seeing today. HIV is no more a death sentence. We are seeing that people who are on ART can also live their normal life. We're also seeing that those who are on drugs, ART drugs, can also not transmit HIV infection to their partners. The program data that we are seeing in FCT, for example, is showing us that actually the new infection is coming down. You know, Nigeria is very large, it's very big. In the world over, Nigeria still accounts for the second position in terms of HIV burden in the world, after South Africa.
If we're still having such high burden, then why are you now saying it is not as alarming as it is?
Yes, it's not alarming because the people who are living with HIV that are on treatment are alive, contributing for the economic development of the country. But the new infections, where we're having issues, are those babies, those prevention of mother to transmission of HIV is where we're having major challenges as regards new infections.
So definitely, there's still a challenge in curtailing that. That is what you're trying to bring.
Yes, there's still a challenge in curtailing that.
Okay, let's find out from Gloria. You said so many people are on ART. So many people are getting treatment. How true and how effective is this line of getting people infected?
Yeah, to talk about the success story today, more people are on treatment compared to as far back 2005. And the facilities, the treatment that we are talking today, more people are being enrolled into the treatment. As Dr. earlier said, once you're on treatment, the chances of you transmitting the virus to the other person is low. The rate of people getting infected is going down compared to back days where we are coming from. So there is a lot of improvement when it comes to treatment to HIV and AIDS in the facility.
That period you said between the time and 2005, let's say. But there were indications that between that same 2005 till about 2016, there were cases of funding not effectively coming up for maybe drugs and some other areas of concerns of treatment. What is the situation now, at least? Good enough, you're the financial secretary. So how much of that, what kind of support in that direction in terms of funding?
Yeah, I could say, let me just picture out something here that in the previous time, we have difficulty by getting these drugs. Sometimes you go to the facility, they will tell you drug stock out. Sometimes you don't have even the transport money to get to the facility to get your treatment. Sometimes you have a lot of difficulties around you. When you talk about the stigma, talk about the attitude of the healthcare provider, talk about the environment, the facility. It's not conducive, it's not friendly enough.
Is it like that to take
No.
It has changed?
There's a lot of
in the center where you get some of your own drugs.
Yes.
Can you say the same for other parts of the country? I'm sure you will network.
Yeah, we network. Like Dr. rightly said, in FCT, we have, in terms of equipment, when it comes to getting the drugs in the facility, that's no too much stress when going to the facility to get the drugs. Everything in the facility, both the drugs, even the co-infection drugs, some of the co-infection drugs are free, the TB treatment are free, and other things around it are free. And when it comes to PMTCT, as Dr. rightly said, in this platform we have what we call mentor mothers in the facility, where they are. Mentor mother is like somebody who is positive, who she or the woman is positive, and the person in question is give birth to a negative child, and that negative child, that person will be trained to be a peer mentor in that facility, training other mothers who are also positive, passing the same.
Okay, so why are we now having fresh cases if we have instances like that, so many? That we've had some states, I don't want to be called in state, and so they won't send some alarming signals to some persons in such location. But there are fresh cases of mother to child, which already you alluded to as well, that is of concern to you. So
yes, there are some challenges when it comes to the prevention of mother to child transmission services in some localities, because some of the mothers, you know, in Nigeria today, most of the mothers are actually the ones that is holding the homes because of economic downturn. So the woman may not have the transport fare to go to the nearest healthcare center. But the good news in FCT is this. Currently, we have 372 HIV counseling and testing services. It has been scaled up.
Okay.
I'm able to say that in FCT, no matter how local the primary care center is, you can receive HIV counseling and testing services, no matter how remote that center is. Yes, because we have over 375 of such centers. We also have over 326 centers where pregnant women.
So do you have new cases of those mother to child? You call it PMTCS.
Prevention of mother to child transmission. Yes, because the problem we're having is that we are having such cases is that mothers who did not undergo their antenatal care in our facility, for example, and come from neighboring state to deliver. Okay, at the point of delivering, you now notice that this woman is positive. She's already in labor. Maybe the third time, the baby is almost coming out. You run the test, the woman is positive. Of course, that baby that is being born stands a very high chances of being infected. Quite unlike a woman who was identified, a pregnant woman that was identified that is HIV positive in our center right from the beginning of the ANC. And she is enrolled into care and she starts taking her antiretroviral drugs. The chances of that child coming down with HIV is very,
Okay,
very remote.
all right, now we get it. So it could be this handful of people you said
Yes.
are coming from neighboring states into the Federal Capital Territory, as well as maybe some of those states that you have.
Yes,
now,
yes.
let's take a look at such children now already infected for no fault of theirs.
Yes.
What kind of care do such babies born with HIV or infected with HIV at point of delivery?
Yeah.
What kind of treatment do they get?
Yeah, we have procedures of handling such a child. We call them high-risk exposed infants. High-risk exposed infants.
Okay.
So we have immediately the child will be provided with a prophylaxis treatment.
Okay.
His or her blood sample will also be taken for HIV testing, while the child is already on prophylaxis to ensure that the child does not come down to HIV positive. So these are already in place in ensuring that that child, the chances of that child, despite that the mother came at the time that she was already in labor, and she did not attend antenatal in our facility. She just came in to deliver, and she was identified as HIV positive. We commenced prophylaxis when the child is delivered. Not only once, even at the time of delivery, the healthcare, the midwife has also already been trained on how to take such a delivery in reducing the risk of such a child coming down with HIV. So all these things are technology, these are strategies, that SOPs that are already in place for such a child coming with a woman that has not been. So all those things are debated. What I'm saying is that the chances of such a child that the mother did not undergo ANC,
especially places where you have such facilities. Now let's take a look at what parents you can actually do. Like I already pointed out, I know some of your networks, you hold, at least you have your connections of network across the country. I know you've been talking more about what you have in the FCT. Definitely we can still share some of your peers' attention to other caregivers too across the country. Now let's take a look at mothers and maybe even your own network. What kind of assistance do you get to give maybe those across who are not having such facilities where their locations are?
First, we have what we call the adolescent support group that we meet every month. So in this adolescent support group, we coach them, we talk to them, and also educate them about their medications. And we also have what we call home-based care services that we follow them down to their various homes to find out how they are doing, if they are actually on their treatment, and if they are sick. We also do the same services by following them straight down to their doctors to also have one-on-one communication with them. And we also make it friendly too. Some of them also are also in boarding schools too. And in that boarding school, we will make sure that for the fact they are in boarding school, in no account will they stop taking their medication. And we work together with the parents, the caregivers. Sometimes we discover that some of those parents are not their biological parents. They are foster parents. But with that, we have to integrate so that the area of stigma, self-stigma or whatever will not come in between. So we have to stand at the gap to make sure that those children is on their medication and they take it regularly without breakdown or having any complications.
Okay. All right. So when we return from this break, Doctor, and also Blessing, we will take a look at how stigmatization, like you already pointed out, is fueling this aspect. Because for some, we hear people say, okay, is once you die, even if I'm infected, it's going to let me continue on that spree and get as many people to come alongside with me. So what are we doing to actually change this trend? Yes, if you've gotten it, you're good enough, you're able to take care of yourself and stay alive. You're watching Nigeria Today, and the focus is on new HIV cases in Nigeria. Now, we'll take this break and we'll be right back.
The Nigerian Television Authority News 24 channel, your dependable all-round news station, offering you world-class news programs, documentaries, spotlights, promos, and information highlights. Take advantage of our network reach and advertise your interest, goods and services with us. NTA News 24, first equals with digital broadcasting. You can reach us on channel 21 terrestrial TV and channel 101 on the Star Times platform. For more inquiries, please call Coretta 0803 618 9986 or Henry on 0803 379 0884. Join us today.
Communication technologies allow the free flow of information to and from one source and another. Are these sources authentic? If the sources are not verifiable, then it's fake news. Don't share, don't kill. Fake news kills. This message is brought to you by NTA News 24.
Welcome back. If you just joined us, the program is Nigeria Today, taking a look at new HIV cases in Nigeria. Before we went on the break, we actually touched on the aspect of stigmatization. How is it helping or aiding people to actually spread this virus and not being loved in one way or the other to actually say, okay, you might have gotten the infection, but you can actually stay alive. Okay, doctor, let's take a look at that aspect. Many people still living, or people living with HIV, even it's just happenstance. Maybe they go for some other kind of treatment and they happen to find out that they are positive. Well, what role does stigmatization play in why people are not getting tested, and how are you addressing this issue?
Yeah, stigma and discrimination remains one of the factors that is fueling the HIV infections, especially in the community. And we have designed different strategies on how to be able to get over it. I want to say that the people who live with HIV are actually helping us in debunking the myths that some people are still having in the community, by going to the community, engaging the community themselves, telling them that, look, HIV cannot be transmitted by shaking hands. Because most people don't even know the mode of transmission of HIV. And that is what is fueling it. People still believe that HIV can be gotten through mosquito bites. Can't believe that. HIV can also be gotten through witchcraft. There's some of the myths that is surrounding it, that we are engaging the community members to understand that there's no way you can get HIV through those means, through witchcraft, through mosquito bite.
How strong is this engagement or disengagement or advocacy? Gloria, I know for your organization, or at least your own units, alongside other civil society organizations, how much push are you giving this advocacy for people to actually know, okay, go for tests, so at least we won't have fresh cases? You're not happy, this is the state, but definitely you will be happier if more people are living healthier. We cut it off, and all of that.
Yeah, there is a lot of activities regarding to that when it comes to the community, as Dr. rightly said, and it also comes to our religious leaders and our cultural also belief. Then the people that is wearing the shoes will now be the one to pull out the bull, go to the community, bring more awareness. I think let me just give an instance where we went for a program. I think it's one of in the north, and somebody just came up and said, "I'm living with a virus, and if I didn't tell you, you wouldn't know that this is who I'm living." And this somebody that she knew her status and she has been on medication, but because of the self-stigma, she's just there without associating with anybody. But because of the testimony she have, she picked it up, and today she's doing extremely well. So we use human face. It's not, we don't use a different person to come and give a different awareness. We use the person living with a virus to create a positive impact. If you are adults, if you are, we have a age bracket. We have from 10 to 19. We have from 19 like that. So in that groups, you have your peers. Okay. In those peers, we have champions. We call them peer champions. Those peer champions go into the community and tell them that with HIV, you can live your normal life. You can give birth to your child. You can marry. It don't limit you. You will be wherever you want to be in life. And with that, we are making a lot of success. We are making a lot of progress. And thank God for the government that we are today. They don't leave us aside. They take people.
How do we begin to stop fresh cases? At least apart from those who already that are being cared for, fresh cases. Doctor?
Yeah, fresh cases, yes, we are still working on that, especially exposed infants, those delivered by the mothers that are HIV positive. So, and especially those that do not have the privilege of attending antenatal care where HIV testing and counseling are being done to be able to identify them. So we are carrying a campaign down to the hinterlands to ensure that people actually have the opportunity to access these services. I want to also say that the government is also trying to revitalize some of the PLCs, because what is actually making some women not to go to the nearby hospital to access services because of the environment of the hospital or the primary health care is not all that conducive. And that is why we see people leaving the community, coming to the urbans to access services. But thank God, the government of the day is trying to revitalize those primary care boards, so that people can now have a walking distance to just move in to the nearby primary care center and access these services. Of course, HIV counseling and testing is the entry point. If you do not know your status, there is no way you can be able to access others. So I think in terms of scaling up the services is ongoing to ensure that people can actually be able to access the services as close as possible with them.
Yes, I know I raised the issue about global effort to end HIV/AIDS as public health threat by 2030. How feasible is this for us with all this Armstrong issues still hanging on?
Yeah. Ending AIDS by 2030 is an aspiration. It's a vision that the whole world is looking at. That look, if the whole world put their hands together, we can be able to overcome.
Are we setting anyone close by for ourselves, at least to actually meet such aspirations?
Yes, the first step the country has done, Nigeria has done, the government of the day was to say, okay, fine, everybody that is HIV positive must be on treatment. Years back, it's not all the people that are HIV positive that are on drugs. We look at your CD4 count and see, unless it's less than 500 before you place on drugs. But it's no more like that. Start for 2016. As of today, in Nigeria, if you are identified that you're HIV positive, you are placed on treatment immediately. Irrespective anywhere in Nigeria. So we really want to thank the government of the day for having that bold step. Because to keep one person on treatment for 1 year is around 54,000 naira. So it's a huge.
So everyone that there's care actually.
Yeah.
Your last comment.
Yeah, as you rightly said, we call it test and treat. That is, to get the Vision 90 target by 2030, which the 90% of people living with the HIV virus knows their status. 90% of people who knows their status are already on treatment, and 90% of people who is on treatment has already suppressed viral load. So with that, I believe we may,
Okay. Well, that's it on this edition of Nigeria Today. We'd like to thank Dr. Uche Okoro, Project Manager, FCT Agency for Control of AIDS. Faka, thank you very much for coming.
Thank you for inviting us.
Also like to appreciate Mrs. Gloria Blessing Ogodov, my namesake, wish you well, the Financial Secretary of the Association of Positive Youth Living with HIV/AIDS in Nigeria. Thank you very much for coming.
Thank you.
We also appreciate you for watching. You can actually watch this edition or any other edition at all online at youtube.com/NTA News 24 Hub. And on behalf of everyone of us here in the studio, wish you a pleasant evening and have yourself a fabulous weekend.